Okay, good morning and welcome to TPA Tuesday. I'm glad so many of you could join us today. I'm Ted Ritter, the Manager of External Affairs for the Njtpa. Our TPA Tuesdays are a key component of a public outreach effort that really began this fall to inform the Njtpa's next long-range plan, which we call Plan 2050. Today, we're talking about advancing equitable transportation systems. And I think the time you spend with us today is definitely going to be time well spent. But before we get started, let's get some basic housekeeping items out of the way first. We're using Zoom webinar today, as you probably figured out by now. You'll notice that all attendees are muted, and this is to avoid any background noise during our presentation. So if you have any questions for our speakers, what you do is you click on the chat icon in the menu at the bottom of your screen. Then the chat box appears. You can post your questions right there. We'll do our best to get through as many as we can in the order they were received, of course, as time permits. I just want to quickly run through our agenda for this morning. After our welcome remarks, we'll hear from our keynote speaker, and then we'll go into a moderated panel discussion, right? And we'll go through the attendee questions after the panel. So right now, I know we're all eager to get started. I would like to introduce Mary Amin. She is the Njtpa's Executive Director. Mary?
Thank you, Ted. Good morning, everyone. I'm really excited about this program today, and our attendance numbers point to the fact that transportation equity is truly a compelling issue. As the Executive Director of one of the nation's largest metropolitan planning organizations, it's important that we are addressing this issue here today, as well as in Plan 2050, which is as much about people and opportunity as it is about transportation. The Njtpa is committed to ensuring the benefits and burdens of our programs and projects are shared equitably across our region. This is memorialized in our Title VI implementation plan, which our board approved and adopted in September of 2019. But the past year has made it clear that we can and should be doing more. One of the key roles metropolitan planning organizations like ours play is bringing people together to collaborate and discuss important issues for our region and beyond. It's important that we talk about racial, economic, and other systemic inequities, especially as we update our next long-range plan. We must ensure that our vision for the future is an equitable one that addresses the needs of our most vulnerable populations. I'd like to thank our speakers, Stephanie Gideby, who is giving our keynote, as well as our panelists, Flora Castillo, Jen Robertson, and Donald Burns. I also want to thank our moderator today, Byron Nicholas. For those of you who don't know Byron, he is the supervising transportation planner for Hudson County, and he serves as the alternate representative for the county executive on our board of trustees. And yesterday he was elected vice chair of our Regional Transportation Advisory Committee. Congratulations, Byron. And of course, I'd also like to thank our first vice chair, Freeholder John Bartlett of Passaic County, for helping us get started this morning. You will be hearing from him shortly. As Ted indicated, our TPA Tuesdays Symposium series is just one part of the outreach for the long-range plan that we're now developing. For example, we just published a background paper focusing on transportation technology, and we're gearing up for additional virtual public outreach opportunities and events in the new year. You can get details and updates at njtpa.org/plan 2050, and you can also take and share our brief Plan 2050 survey. We really value your input and ideas for Plan 2050, which we expect that our board will adopt next fall. So thank you again for attending today's TPA Tuesday Symposium. Now I would like to introduce Passaic County Freeholder John Bartlett, who serves as the Njtpa's first vice chair, to say a few words. Thank you.
Thank you very much, Mary. Good morning, and thank you for the opportunity. As Mary said, I'm Passaic County Freeholder John Bartlett. I'm proud to represent the county on the Njtpa's Board of Trustees and to serve this year as first vice chair and as chair of the Project Prioritization Committee. Today's TPA Tuesday Symposium focuses on the topic, advancing equitable transportation systems. And equity is certainly among the very top issues that we face locally, regionally, and nationally. Think for a second about access to transportation and how important it is to so many aspects of your life. Now think about how many lives are negatively impacted due to lack of access to transportation that gets people to work, doctor's appointments, social services, the grocery store, school, and so forth. In my home county, the city of Passaic has the lowest household ownership rate for automobiles, 43%, of any municipality in the state. Patterson, our county seat, is close behind. This matters to my constituents and it affects our economy. The difference between the time it would take me and my car to get to work and it takes someone who has to take 2 buses and walk a mile to make that same trip is a tax in time on those least able to pay it. That's why Passaic County is investing in transit, advocating for a rail connection between Patterson and Hackensack that will provide access to Hudson County and New York, which you can read more about at northjerseyrail.org, and pushing for bus rapid transit between Patterson and Newark, among other things. Not providing access for everyone is a critical problem, and the NJTPA wants its next long-range Plan 2050 to address this concern to the greatest extent possible. We want to help our region's most vulnerable residents and those who've historically lacked good transportation access to get where they need to, when they need to, as easily as possible. And we also want to ensure that these residents are not unfairly impacted by transportation investments, projects, programs, and decisions that we make in North Jersey, as has historically been seen across the country, where infrastructure investments can reify rather than ameliorate divides of race and class and so forth. And of course, we find ourselves also in uncertain times, as all of us on this Zoom call, which we wouldn't have been doing a year ago, can certainly recognize. The immediate challenge of the pandemic and the longer term crisis of climate change are there, but one thing's certain, this current health crisis will pass. The climate challenge and the need for resiliency, the need for transportation to get all of our constituents where they need to go is not going to go away. And the realities of climate change mean that the need for transportation resiliency and redundancy will only increase. I'd suggest that as one of the nation's largest MPOs in one of the country's most diverse regions, the NJTPA can lead by example by looking at race and equity issues not solely as obstacles, but also as opportunities. And on that note, I'd just like to say we've got another great program today, and we're so glad that you joined us. I think you'll find the insights of our keynote speaker and panelists very timely and thought-provoking, and I'm looking forward to hearing the discussion and your questions. So thank you again for being here, and I'll turn the program over to Ted to get us started.
Thanks, Freeholder Bartlett. Wow, what a perfect setup to our program today. So let's get started. Next, I would like to introduce our distinguished keynote speaker. Stephanie Gideby is the CEO of Northstar Strategies. She's a champion of public policy solutions that promote economic, social, and environmental benefits for communities. Stephanie also directs policy and partnerships for the Natural Resources Defense Council. She's a policy advisor for the Strong, Prosperous, and Resilient Communities Challenge. And she has experience ranging from the municipal level in Orange, New Jersey, all the way to Capitol Hill. Not to mention she served in the Obama administration, working on the economic opportunity agenda over at USDOT. And she was the New Jersey Director for Public Engagement, heading up the Superstorm Sandy Task Force led by the HUD Secretary. In addition to holding a master's degree from Seton Hall University, Stephanie guest lectures at Johns Hopkins, serves as first vice chair on the board of directors at the Washington Metro Transit Authority, representing DC. It's an honor to introduce Stephanie as today's keynote.
Thank you, Ted, and thank you to the leadership of Njtpa for the privilege to speak to you before you today, and for the panelists who will be having a discussion with following this session. Today is really a career highlight as it brings to bear kind of my full experience. Many of the lessons that I've learned, the things that I've experienced have started in the great state of New Jersey. As Ted shared, I grew up in North Jersey, in South Orange, and I had the privilege of working for Congressman Donald Payne from New Jersey, Senior. And from there, I returned back in part because every time I would come back to the district, I realized that there were so many resources that we still needed. And I found it important to really work with the local municipalities to really identify ways that we could leverage and harness the federal government to scale local solutions that we needed so desperately at that time. It was also an opportunity for me to return and to support the city of Orange, and I'll talk a little bit about my experience during my tenure there. But it also brought to bear the impact of what climate change meant to the region. As a Jersey girl who loves the shore, I don't think that I fully understood the implications of the impact of climate change for our region. I had always been an everyday environmentalist, but it wasn't until Hurricane Sandy really took harness against our state and also the region, New York as well, and Connecticut, that it became very personal to me. And it became my personal issue because I realized the way in which it exasperated many of the challenges that really already laid to bear the systemic inequities that we saw throughout communities. Coming to work at the federal government under the leadership of Secretary Fox in the Obama administration was a privilege to really take many of the lessons that I had learned in New Jersey and bring it to scale. So this discussion is really an opportunity to highlight both our history and also our journey as a country and also as a region, and offers a space for us to really think about how do we advance equitable transportation systems and investments, both for our region and for the nation. Before I start, I want to just offer the caveat that we are going to be going on a journey today. And it's an opportunity to really kind of highlight the ways in which we got to this moment. As Ted shared, I'm the CEO of Northstar. And for me, it's really about being able to serve and be the light for leaders who are working at every level of government. And I believe it's important for us to truly understand the values in which we speak from. So I'm going to kind of share why I believe as we go on this journey, it's important for us to also understand the important principles that have guided the work. For me, it's important that we really navigate this space when we start to talk about equity and really embrace the opportunities to navigate the uncharted territories. The ways in which we have seen the storms, the flooding, and the impact of climate change is something that we could never have planned for. It's also important to really understand the origin story of a place. The fact that New Jersey has 565 municipalities, all unique, home rule state. Every mayor, every council feels like they are and knows that they are the most critical voices for their residents. And being able to navigate kind of the political dynamics of what it means to have those many municipalities, 21 counties, and also the densest, well, one of the densest states in terms of being one of 11 in the country, and being able to also, especially for North Jersey, have a combined impact of economic impact to the region is critical. It's also a space, as we talk about transportation and equity, to really kind of move with a space of radical imagination. And the term really kind of comes from Angela Glover Blackwell, and it's that notion to push beyond the status quo. Often when we have these conversations, we limit ourselves from being able to really think about what the possibilities are. Having a true discussion on transparency and really identifying what are the non-negotiable factors when we're dealing with other people. And then to move with at a sense of humility, recognizing that you can never be an expert of a home that you've never lived in. What makes it personable, what they love about the community, what they love about their ride is all to the own individual's experience, and being able to lead with that understanding is important. I often describe myself as a systems change strategist, and I talk about it in part because when we talk about having to navigate the spaces in which community leaders have to, both community leaders and residents have to figure out, are not limited just by a single sector. The investment that we make in transportation has a huge impact on the economic realities for a city, a town, a municipality, a county, a region. And so recognizing that interconnected and dynamic relationship is critical for us to thrive. Really moving beyond kind of this transactional relationship and moving towards a more transformative relationship when we start to really think about how do we build trust and understanding and shared commitments of our core measures of success. One of the great experiences that I believe Njtpa was able to lead was the Together North Jersey experience, because it brought thought leaders from across the region to really start having a more regional conversation, recognizing that every municipality has their own jurisdictional priorities. And being able to acknowledge the unheard voices, unseen faces, and unspoken truths that impact the dominant culture and those who have to navigate those pieces. And finally, being able to respect both the history and legacy and cultural assets of a place and what makes it important. So with that guiding philosophy, it's the journey that we will go on over the next 25 minutes to really talk about the legacy of racism and exclusionary policies in our transportation system, really understanding the past and how we've got here as a country, why place matters as part of this discussion, really thinking about moving forward, how do we build more inclusive places? How do we plan so we all thrive? And how do we advance systems change strategies that help us to really think about the investments that we make for our future? When we talk about the values that hold our nation together across America, it's really this notion of liberty and justice for all, that this is a country for the people, by the people, that all men are created equal. And is the values that we espouse, but not always that we live by. And then when we talk about these values, we have to understand who we were talking about during that time. It was really the reality that we were talking about white men who were also owners of land. And so it has taken a journey for us to continue to amend our Constitution, our laws, to ensure that everyone is seen and can thrive in this nation as part of the discussion. It's also important for us to understand the legacy of racism and exclusionary policies, particularly within transportation. I think what this summer brought to bear was the reality of the implications of systems that have impacted Black and Brown and Indigenous communities for centuries. And that at the core of it, transportation has been a critical framing for this level of exclusion that we've seen. The notion that when we talk about transportation, it's beyond just the physical investment, but also the symbolic, that transportation has also been the hope for many folks who are traveling what was symbolically known as the Underground Railroad. The notion that it was also the place that brought great despair when you think about the Trail of Tears for those who are crossing over to new lands, Indigenous folks whose natives' lands were taken from them in the process. And really thinking about the expansion of place and who had an opportunity to build those pieces out. That continued even onto the West Coast when we talk about the transcontinental railroad as part of those pieces. It's the reality that when we think about the separate and unequal doctrine that really guided the policies that we saw from a segregationist policies that started with Plessy versus Ferguson, that it was on the transportation rail lines that we saw the limitations and barriers that impacted an entire country for almost a century, but that it required people to make different choices. It's also the reality that there are people who had a head start to the American dream that we talk about, that the Indian Removal Act was really the forcible displacement that made room for white settlers. That when we start to have this conversation about who is an immigrant and what that means and who has the natural right and ability to have access to the things that we pride ourselves in our values as a nation, that we were talking about white people. And that when we talk about the laws that have limited people from being able to thrive for decades, it was based off of this Jim Crow system. That for all the progress that we made along our journey as a nation, that there were things that pushed us back, and that it required us to make different decisions along the way. I highlight this because it's important when we start to talk about race and equity. We often say, well, I had nothing to do with this journey. It was not personable for me. I never discriminated. I was not the person who did those pieces, but you may be benefiting from it. And because of that benefit, it gives you an unaccessible and head start to being able to benefit from things that most people take, that you may take for granted as part of it. It's also important for us to understand our past, because the decisions of the infrastructure investments that we made truly impacted communities for generations. I often talk about our interstate system, and when we were building it out in the 1950s and 60s, the reality is it was a different America where we consciously divided people based off of race and class. It was legal and acceptable. So when we were building our highway systems throughout communities across the country, it was not an issue to divide people, residents, by race and class. And that implication continued to affect communities till today as part of those discussions. And that it wasn't limited to just race, but that, you know, even it wasn't just limited to race, but it was also the reality of class. Poor white people also had that same implication. Rural communities that were able to have these small towns where people rode through were no longer their story when that access way was cut off. And understanding that this is not something that was limited just to a couple of spaces across the country, but many towns and cities across America. In most places, when you think about a highway, you often can also see the dividing line of the haves and have-nots, that those train tracks really, you live on the other side of the tracks for a reason, in dividing communities when we divided communities based off of those realities. And that there were also planning decisions by the federal government that impacted who lived where as part of those pieces. And that forcible displacement has continued to impact this current generation as part of the discussion. I bring this conversation closer to home for me as someone who served as chief of staff for the mayor of the city of Orange. I remember the stories of the residents in the Oakwood neighborhood of Orange talking about the connections that they had, the civic associations, the way in which residents had civic associations and a strong sense of community, and how 280 became the dividing line for the residents. It was the further disinvestment in their neighborhood that limited what was a historically Black neighborhood. And I don't think I fully processed the implications, but it was not until I truly deepened my study that I could still see the impacts. On this map that you're seeing right now, the green neighborhood is what we call the South Ward, Seven Oaks. During my tenure, many of those homes were $500,000 homes, bigger and more beautiful than most can imagine. But across that line, in the areas that you see as red, where the east was the East Ward. It was also the neighborhood that often flooded, and it still is today. It was also the area in which the government had declared was not worthy. And so we still see those same implications in a small town like Orange because of the federal decisions that were made and the state and local executions of many of those decisions as part of this discussion. I also bring up the reality that the notion of who has access to move where is defined in the codes that were created early on, in the Black codes and the slavery codes back in the 17, 18, 1900s. It continued to define how people could move. And we see that even now as we think about who has the right to safety and what it means to call the police on someone. And that defining of Black movement continues even in the ways in which we plan for places. The Green Book often was the traveler's guide that offered a level of freedom across America for many Black folks as the automobile became a new way of transportation. So I talk about the impact of the interstate system, but there was also great benefit. It opened up the country to I offer my context through the African-American experience, but through many Blacks who had to navigate a system in which there were laws on the books that limited their ability to thrive. But that same notion of who has the ability to move also became the reality of how we define the spaces that we travel in. The other Green Book that you see is a association's Green Book that really has guided engineers for the last 25 to 30 years. It is how we plan our streets. It is what gives, it is what offers the structures that we see to define the spaces that we live. And both, ironically, are considered Green Books, but have defined how many Americans have been able to move for years. So I bring this conversation home to you because I think it's important for us to understand how many of those how many of the lived experiences still affect us today. When you think about who migrated to your community, especially early on, when we talk about the Great Migration of communities, it offers us the space to really understand the history and the culture. What did they leave and why, and how did those pieces still, and where do you still see those pieces showing up? Where are the highways in your community, and is it still the dividing line? Where are the towns, what towns and communities are connected and part of kind of the regional or local identity for a space? What happened to the other forms of transportations as a result of the highways or the infrastructure that was built, or the lack thereof as part of the discussion? This legacy of racism and exclusionary policies are still found today, where we still see separate and unequal access to funding and prioritization as to who can benefit. The notion around bus versus rail and what is considered the priority, who even has access to sidewalks? Communities intentionally creating the barriers so that you cannot walk in their neighborhood as part of those pieces. From a gender perspective, just the reality that our transportation system was not necessarily built by or including or thought of to really support what women may need, or other genders as I self-identified in the process, and still seeing that need to amend our values, our systems, our plans, and seeing the intersection of all of those pieces as part of our strategy for how we move forward. What we also know is that place matters, that your zip code has more of a determining factor on your life expectancy than your actual genetic code as part of this discussion. And as a result of this, this reality continues to further the divide in terms of your ability to live, your ability to have access in income, your ability to move up the social and economic ladder of life. And that this level of inequality has continued to widen since the investments that were made in the 1970s. And that, again, everyone did not have the same head start in terms of just where you live, but also your race and your class, in addition to your gender as part of those pieces. I also raise this issue in part because I think now more than ever, when we talk about the life expectancy, that for the first time, we are now seeing the life expectancy of white people also declining. And this is important because it means that nobody is benefiting from the systems that have been created. And there's a real opportunity for us to harness ourselves, not just based off of addressing the inequalities of race or class, but that as Americans, we are not benefiting from this current system. That the social determinants of our health go beyond our physical behavior, what we may be able to do from access to health. It also is the physical environment and the social economic factors that impact how long we live as part of that. 80% of our health outcomes are based off of this truth. And to make matters worse, we continue to see that exasperation in terms of where you live, even based off of what is placed in your surrounding areas or what was built around you as part of it. New Jersey is an intermodal community, intermodal state where we have access to the ports, airports, trains, planes, automobiles as part of it. But who has the right to clean air is also a critical discussion that we continue to engage in. This is important in part because even as we talk about the implications of George Floyd and that we watched a man suffer to breathe for over 8 minutes, that for many places across the state and nation, the notion of the right to breathe is a privilege that we are still trying to figure out. And to further exasperate the situation, climate change has made the matter worse. And so there's a real opportunity to really think about how do we build more inclusively? How do we build with greater values and metrics that really kind of support greater mobilizing inclusion? Really recognizing that there needs to be greater context to the communities and the implications as part of it. Really supporting a process that promotes greater trust and participation. Recognizing that many communities have been over-planned and over-promised but not delivered on the visions that have been set forward. And really thinking about how you design your programs and your planning to really think about access, increase access to opportunities, and really being able to build in that sustainability long after a project is built. Being able to have greater context as part of that conversation is important, in part because you need to understand who lives here now. We often plan for who is coming, but not who's here now, and the needs of that community is part of that. Being able to understand the implications of the decisions made prior to your arrival into a place as part of that, and being able to identify the exclusionary factors that impact that implication as part of it. We also have conversations that are often dealt from a scarcity mindset, what we lack versus the community assets that are already in places that can be used as a building block for investment and for a further development of the process to include more voices. To that notion of process, the importance of being able to build that civic trust, that participation, that social capital. Again, recognizing that many communities have been overplanned, but but lack the delivery of the things that have been promised. And that notion of a failed promise continues to be the pursuit of what we all strive for when we develop policies and plans, but there requires a level of intentionality in the ways that we design our programs to offer that level of quality of space. In this conversation, I've spoken a lot on equity from a racial perspective because of my lived experience, but even who has access and the conversations around accessibility. What does it mean for the users and those who use it every single day? It's interesting because many of our policymakers often don't experience the system as their residents and their voters, and offering the space to take them on those journeys to really see how their residents are experiencing the neighborhoods and the communities that they see. And then the importance of being able to sustain the discussion in terms of ongoing engagement, being able to offer new spaces to continue to prepare for the changing evaluation of what a community may need along its journey. I think, again, this next stop is really focusing on how do we go from transactional to a transformational, inclusive opportunity for community change? How do we plan so that we can all thrive? And I think this conversation really goes to the programs, the processes, the policies, and the plans that we put in place. I put forward this slide because I think it's important when we start to have conversations around how we advance a plan, we really don't think about the full transportation life cycle. I'm grateful for Njtpa because they kick off the discussions on what we see for ourselves. And it's important for a city, a region to have a vision, but that plan and that level of engagement has to sustain throughout the entire process. it can't stop from just the first engagement, but it needs to continue on through the design, through the construction, really thinking about what businesses are being leveraged to support the economic investment that may be happening in a community. We spend billions of dollars on our physical infrastructure, and there's a real opportunity to create new spaces for small business, women-owned, minority-owned businesses to be part of the process. The notion of how we continue the operation and maintenance. We love to plan and build shiny objects and host ribbon cuttings, but to maintain that infrastructure continues to be our biggest challenge. And being able to offer the space for feedback is often where I would say you hear customers, constituents, riders, and residents complaints. Long after the shiny object has been built, the real challenge and the importance of the execution of maintaining that asset is just as critical. And being able to ensure that it's still working for those that was planned for and those who live there now as part of that. And centering this discussion on affordability and resiliency. And when I say efficiency, I would say innovation for our future. The notion of bringing together both the equity perspective, the importance of the social determinants of health perspective, and the reality and implications of climate change, really centering people along that process. And that even as we think about the policies that define how we are investing in places, that we engage residents, customers along that same planning process through the analysis, the design, the approval. Often after the bill is signed or the legislation or the ordinance is passed, we think that that's the end, but the important piece is actually the implementation. And moreover, the enforcement. We have many rules on the books, but we don't necessarily enforce those policies as part of that. And so we have to really continue to think about how do we not settle for what we have put forward, but that we continue to refine and get better as a region and as a nation. I also bring together this thought called targeted universalism. It comes from John Powell from USC, and it really is this notion of how do you both address the reality of everyone and also address the tension of those who are most impacted by the system. And he brings those two worlds together through this notion of targeted universalism. And the thought process behind it is that you can be able to both set a big vision for what you see for the region, but also address the individual needs of residents, customers, riders, constituents as part of that discussion. By being able to establish this vision based off of robust engagement, assessing who is most impacted by those decisions, being able to target from both a geographic and population standpoint, recognize the barriers that are part of the reality for why they may be limited from being able to experience what everyone else is, address those barriers, and really pull together a plan for each of those groups. The other concept that I want to bring into this discussion before I start to wrap up is this notion of the curb cut effect. And it comes from Angela Glover Blackwell, and she and Angela remains the founder of what is called Policy Link, a national organization. I bring it forward because I love the concept. It's one of the best examples because when we start to talk about equity, when we talk about what it means to being able to target policies for a specific group, people will quickly go to this space that says, well, I want something for me too. And the curb cut is the perfect example because how many of us have used the curb cut to roll our bags, our strollers on that curb that was intended for one specific group, those who benefit from and who by law those curb cuts were created through the ADA. This is important because it was a law created for a very specific group, those who have accessibility challenges, and yet we all benefit from it. Another perfect example is the automatic door opener. We've all benefited from it, but again, it was targeted, created, designed by policy and law for one group, but we all benefit from it. And so it's a great way for us to reorient our mind in the space of radical imagination, that you can target and address the limitations and barriers for one specific group, and we all benefit from it. I would move forward by just really asking, how are you co-creating and integrating equity as you start to really think about this process? We often will say that the challenges are beyond our control, but in the places that you do have control, how are you engaging the appropriate community voices, and have you ensured that those who are most impacted have been part of the process? Really asking yourself currently, who benefits and who's burdened by your project or the process that you're developing? How can you decrease those burdens? What groups or ideas are left out as part of the decisions that you're making? And what are the unintended consequences? The question around unintended consequences is critical, because I think we make these decisions thinking that we're benefiting for all, but someone is impacted, and being able to mitigate for those implications are critical as well for part of this conversation. And then really having a conversation, as I started earlier, that we all have not had the same head start. How do we actively use our power and privilege to advance racial equity and economic opportunity as part of it? How do we increase and support sustainability as part of it? And how do we improve the health life outcomes that we see? One of the pieces that I often use in having this discussion is how we engage people in the discussion. Oftentimes when we have a discussion about plans, policies, processes, we seek to inform. We have fact sheets, websites, open houses, but it is a one-way participation. Consultation takes us to this next step, because it's an opportunity to really have a discussion where you get feedback, which again is great, but it doesn't offer this two-way value proposition that offers a way for us to move from transactional to transformational relationships. And as we go on to kind of more involved engagement, workshops, deliberative pollings, you get to really see who is involved, and that everyone can have a further way to participate. And as you move along that participation cycle, collaborate and further empower. Let me just say that every community has that there is an opportunity to support every community to have access to these discussions, but we often find ourselves trying to go to the lowest common denominator to get what we need. And it's important for us to recognize sometimes those biases in our policies as we move forward. The other piece that I want to bring forward is just this concept of P4 models, because when we start to think about how we want to invest in places, we often will maybe use this kind of P3 public-private partnership to be able to move new ideas forward. But if we're not centering it with people and what their needs are, it limits our ability to have the outcomes that we say we want to see in spaces that really ensure that the essential services that we're talking about addresses those who are most disadvantaged, that we promote equity and efficiency as part of it, and that sustainability is part of this discussion. The final example that I'll bring forward is something that the previous administration advanced, which was rides to wellness and is now known as transit and health policies. It's a thought process that you can solve for multiple challenges, leveraging the assets and the investment made by various agencies. For this example, we talk about paratransit and the fact that the healthcare system is already, it does not truly meet the needs of everyone in this country. But that we are spending so much money on transportation to get people where they need to go to as it relates to being able to get to their healthcare providers. And there might be an opportunity to offer this integrated solution for mobility management as part of those discussions. I want to wrap this journey by really thinking about systems change and the strategies attached to them. I call myself a systems change strategist because I recognize that every community and place and system is influenced by people. And so we often say that we have inequitable systems, but the reality is those systems are made with people who can often make different decisions. And by having a bigger picture view of how we might really operate both as a whole and how the silos have impacted the individual activities, we can have a better understanding of the culture for change and how we can really recognize how the role of time and resources limits our decisions, but also offers the opportunity if we build it in earlier. So I often spend time really thinking about how do you create the environment to mobilize people to action and institutionalize change. recognizing that we see the policies and practices at the top of the iceberg, but below the surface is really the culture, the history, the impact of the institutional beliefs, the unwritten rules. That is the reality that we are often having to address. So as I kicked off this discussion, the core of what my mission is everything that happens below the surface, because in influencing those beliefs, you can have the better outcomes for the policies and practices that we see. And that it is important for us to really think about how do we move from the cultural norms that have been established to the opportunities to do something different. As a Black woman who has been navigating white systems her entire life, I recognize that I also consistently have to decolonize my mind and what I believe is the normal for the lived experience for my world. And recognizing that many of the things that I may be advancing have been taught to me in a way in which it limits my perspective and also the ability to co-create in new ways. And so I put this pivot chart because it's an opportunity for us to kind of think about how do we move beyond what is considered the cultural norms of how we do business to really kind of shifting to new ways of collaborating and more inclusive strategies as part of this. I also, in my final slides, want to wrap up by really thinking about how do we really partner more intentionally, especially when we start to think about the ways in which we want to engage, really leveraging and thinking about the fact that we all have an opportunity to foster greater community wealth by where we host our meetings, how we have our conversations and leveraging our resources, being able to think about even just purchasing with a small business when you do your next meeting. I know that we're doing things via Zoom now, but in the future, really thinking about how we support our smaller businesses in the towns and communities that we're trying to do engagement in. Really thinking about how do we enhance our capacity through the shared training and joint events, working with community leaders who often may not have the same resources to advance the conversations that you seek to want to have in this what maybe in offering it from a transactional to a transformative space. Being able to bring and leverage maybe your social media presence to support and highlight the challenges that's something that may be happening locally. Being able to really also think about how you pay for and value the time. It's so interesting when we start to have these discussions because much of it is often led by consultants, but not necessarily valuing the expertise of the lived experience of those who are in community. Really thinking about how you offer in-kind space, how you value that level of open door and closed door conversations that foster trust, and how you offer a two-way value proposition for what you might want to do in partnership. I will end this presentation by talking about the difference between an intent and intentionality. We all may have a greater intent to do something better as our Constitution starts out in its framework, but the reality is that it takes a level of intentionality. It takes a level of intentionality to change the system, to make it more equitable, to do things more differently. In this season, I have been seated with an MLK quote that talks about the arc of the moral universe is long, but it bends towards justice. And the reality is that systems do exactly what they're supposed to. They automate and they keep things the way that they are. And it is not unless we commit to being arc benders and being able to shift the ways in which we move, prioritize, and do things differently that we will become a more just and equitable country, region, city, and community that ensures that we all thrive. I want to thank you because 8-year-old Stephanie is living her dreams by being able to just support the transformation of the communities that she loves. And so I appreciate the time that you guys have given to have this discussion and the intentionality that was offered to really center it both in the many issues that communities in our region are facing each and every day during this time.
Wow, Stephanie, you gave us a lot to think about and a lot to unpack there, and I thank you for that that super comprehensive and enlightened look at our core issue today. I'm very psyched that you're going to be sticking around for our panel presentation, which is next. And I love the way you focused on opportunity because that's a lot of what our long range plan is going to be about. I like spending time in the ocean a lot. And when you catch waves in the ocean, it's all about swell and momentum and forward motion. And in the post-pandemic world, with a new administration and a renewed commitment toward addressing inequities, I think we have a tremendous opportunity. So if you think about it as a wave, we're just going to continue right now with the panel presentation. We're going to catch that momentum and take it forward. So I'm going to turn it over to Byron Nicholas from Hudson County now. He's going to moderate a very enlightened panel presentation. We've got some great speakers lined up. We're going to take questions after. So without further ado, Byron, take it away.
All right, thanks, Ted. Stephanie, wow. Thank you for such a engaging and informative talk. And as Ted mentioned, thank you for staying with us for this panel discussion. I do want to point out the ideas of radical imagination and target universalism truly resonates with me. But before we get to the bulk of the discussion, we would like to give the opportunity to our three panelists to provide their reactions, responses to Stephanie's keynote speech in the context of their own experiences and backgrounds. So we'll have Flora, then Jen, and Don. And Flora, you may go first.
Thank you, Byron, and thank you, Stephanie, and the panel for the opportunity to be here with you. Stephanie touched on several key areas that, as a former healthcare executive, as well as a policymaker in a transportation role, I've lived myself. And so today I want to highlight one area that she talked about, and that's the intersectionality of all of our institutions and the systems which have a role in building a healthy and thriving society. For me, the pandemic illuminated the opportunity that's in front of us of really embracing different and nimbler approaches to meeting the needs of our customers and the people that depend on our transit systems. It also elevated for me how foundational the role of public transportation is in getting people connected to opportunity and life-sustaining services. So as we aspire to build a more equitable transportation system of the future, we must look at the intersection of health and transportation and leverage the choice points that we have through that customer journey to reverse decades of cumulative and compounded effects of structural racism that has systematically disadvantaged communities of color. Stephanie spoke about the role that your zip code plays in determining your success, your health, and your well-being. As she noted, social determinants of health are the conditions in which people live, work, and play. Socioeconomic factors and physical environment, which transportation is part of, account for more than 50% of what impacts our health outcomes. During the time that I've been in both my roles in healthcare and transportation, I've seen how transportation is a determinant of health and how it impacts individuals' ability to access timely medical appointments, to dialysis, prenatal care, and post-follow-up care. This results in delay in receiving medical interventions that ultimately lead to poor health outcomes, as well as contributing to the rising cost of healthcare. I have also seen how accessible, reliable, and affordable transportation has improved individuals' health outcomes, prevented extra stay and readmittance to hospitals, improved the quality of life of individuals by connecting them to socialization and life-sustaining services like accessing food. So to me, addressing transportation as a social determinant of health is an effort that cuts across all and it necessitates a holistic approach. At the state and federal level, we have agencies such as the Centers for Medicare and Medicaid using their waiver authority to encourage our systems to cover transportation to non-medical destinations. In 2020, Medicare insurance companies cover transportation to social services as a benefit. And at the federal level, the USDOT, through their leadership in the Coordinating Council on Access and Mobility, is also enabling and breaking down barriers for coordination amongst its grantees by providing incentive for coordination, as well as the opportunity for bringing funding to build additional capacity. At the local level, NPOs like Njtpa, transit systems and transportation providers must recognize the partnership opportunities that exist within the healthcare sector to better serve the needs and the mobilities of 10 to 50% of patients who, according to research, report that transportation is a barrier to accessing healthcare. So there is a silver lining for me as I reflect back over the last 9 months. It reaffirms for me that as we redesign our systems and services, we must re-examine the true mission of public transportation and be intentional, as Stephanie said, in centering our policies, our projects, and our investments in people. Lastly, I will lead with a couple of concepts that I think are important as we think about the intersection of healthcare and transportation. One is that we must adopt an equity in all approach, which means that we must start by defining what equity means to us. And to me, it means access to opportunities free of barriers. For example, we know that our systems are not equitable, and in a recent study that looked at Latinos and how to build equitable transit systems, often they report that bus routes are unreliable, infrequent, or even unsafe, contributing to disparities in health, wealth, according to the Salud America. So there's another concept in Houston that looks at the Transportation Equity Demand Index, and that's something that Stephanie talked about looking at ways to look where the demand is to then rally around our services. So I look forward to speaking later in the panel in terms of how we institutionalize some of these ideas. At the end of the day, transportation is a right, and we must design our systems to make sure that everyone is able to use it.
Jen?
Great, thank you. And just to start off, it's an honor to be here with my co-panelists. Thank you to NJTPA for the opportunity to be here. And thank you to Stephanie Gideby for rooting us in the history of transportation and race, inclusionary mobility, what it looks like today, and intentionality, and also to give a brief plug for my love of New Jersey. When I first moved here to the United States from Canada, my first place that I lived was Newark, New Jersey, and have great memories taking the PATH train. So to start off on that, currently living in New York City, working for the Mayor's Office of Sustainability. But my role today is really to connect this work to LGBTQ communities and climate. I need to start off by stating that the LGBTQ community is not a monolith. The experiences of a lesbian, a gay person, a bisexual person, a transgender person, a queer person, someone who's a combination of these things will differ in daily life as well as in power and privilege at a more systemic level. And once we layer on people's income and race, these differences further complicate things. To echo the word intersectionality, that really is the groundwork of the way we need to think of the queer community. This really parallels our work of climate as well. We start talking about climate change in terms of science, and that we know that climate change is caused by increasing greenhouse gas emissions from human activity. But very quickly, it can unravel and start being a conversation around specific communities impacted by rising sea levels or by air pollution. So definitely it starts with a pretty simple groundwork. And then from there are really individualistic and community-based impacts. And the transportation system really reflects that as well. There are some issues that unite the LGBTQ community in transportation and climate. For example, the US Census only collects data on same-sex relationships. And in order to identify your gender, you have to pick an M or an F. And this can be limiting for some members of our community. But filling out the census is still essential. It's the way that we get proper political representation. It's the ways we get funding for public health and public transit. This is definitely something that we still think is core and is important for us, which is why New York City led with an LGBTQ specific outreach campaign. We ended up outpacing what the US Census thought that we would get in terms of response rate before COVID-19. We had an over 60% self-reported response rate because we did outreach to specific communities. And that definitely was core for us to be able to get the type of funding that we're hoping to get down the line to expand our transportation system. But census data and getting this data to be more accurately reflecting our community is really important when we're looking at information that we have on air pollution and climate change. I'm thinking of the EPA EJ Screen tool, which provides really granular information on air pollution and provides information on how communities of color and communities of low income are disproportionately impacted by poor air quality due to infrastructure disinvestment. This contributes to climate change, and on a day-to-day level, definitely impacts rates of respiratory illnesses. And we know that that is a core morbidity factor for COVID-19 and the moment that we're living in throughout the pandemic. So that we have some early studies that are really important that connect air pollution to same-sex couples and shows that same-sex couples do have higher rates of respiratory illnesses and air pollution impacts compared to different sex couples. We definitely need to have more information on how queerness impacts these communities in order to get down to the level of where do we need to see investment in electrification and alternative modes to reduce pollution and improve quality of life for members of the community.
Thanks, Jen. And now we'll have Donald.
Great. Good morning, everybody. And this is it's really an impressive group to follow. And Stephanie, I think Stephanie gave a great presentation, setting the groundwork for everything that we're discussing. So part of the things I was going to discuss, I think Flora hit on a number of them, but so I'll focus on a couple of different things. One thing that that I think we've been looking at and trying to encourage transit operators to pay attention to is where the current routes are, especially for buses. You know, the fixed route trains, you really can't change too much. But we had a transit provider in upstate New York that hadn't changed their routes, their bus routes since World War II. And if you think about everything, Stephanie's presentation about redlining, et cetera, where jobs were, where things were, where people were located, again, that your zip code affects your access to transportation if those routes don't change. This provider started to change their routes and their ridership went up. And part of that is because they were being responsive to where people needed to go now, to what people are doing now. And a lot of their current investments are reflected in that. And I think that's and part of the reason why I think they were successful is because part of their study was rooted in sort of looking at diversity and equity and inclusion and into where, who's riding our system, where do they need to go, and are we making those improvements and improving the routes to do that. And I would say that that's probably where we are with a lot of transit systems now. If we want to make changes within people's lifetime that they can deal with now, that they can appreciate now, and utilize now. And so a lot of them, a lot of improvements can be done either through bus rapid transit, which has become increasingly popular, new bus routes that are getting people to where they go. I think in our looking forward in our post-pandemic society, I think the question we're going to have to ask is the commute to the central business district going to be necessary, or will we have different commutes, and will we see more of the as the freeholder said, possibly the Patterson to Newark, or the Patterson to Jersey City, the Patterson to Hoboken route, because that's where people are working now, or Patterson to the suburbs. And are we making those investments so there can be an affordable transportation system to get them to those economic opportunities? And one thing about this state of New Jersey is you go from very urban areas to very rural areas, and sometimes they're not too far from each other. But that's another barrier. is when you go, when you have that sort of urban, suburban, and rural, and then suburban, urban continues next to each other, they're not that far, but they're not that close either. And I think those are some of the challenges that we're dealing with in terms of making a much more equitable transportation system, because as Flora said, a lot of times those people need to make those connections to just for healthcare reasons. And then the last thing I want to just talk about now in terms of everything is, moving forward, we're trying to make sure, and we're looking at some flexibilities in some of our newer programs and some of our discretionary programs, to look in that flexibility, especially in terms of paratransit and that Flora mentioned, the mobility group that's looking at that. And hopefully that will be reflected in some changes in our policies and programs in the future that will allow some more flexibility. So potentially in the future, a paratransit trip might start on a sort of a Veterans Administration paratransit, but the closest one next is might be Health and Human Services paratransit that can get you home or get you to where you need to go next, and you can just hop on those different vehicles. So I think that's where we're hoping to go in the future, with a little more flexibility. Thanks.
Thanks, Don. And those were all great factors in terms of equity. Before we get to our next question, I just want to ask our panelists to keep their cameras on for the audience to see who's speaking at the time. And the next theme for our first question actually is based on transportation investments and cultural expectations. So often planners and public officials treat communities, their initiatives, and outcomes the same way, and fail to recognize the differing cultural expectations, both in the process of engagement and in implementation. So this next question is directed towards Jennifer and Stephanie. So how can we implement practices that promote equitable mobility and transportation access in historically disinvested communities while addressing some of the community's fears of displacement and distrust in the planning process? And Stephanie, you may go first.
So I think one of the conversations when we start to really think about major investment is how to support investment without displacement. And the thought process around it, I think the short term that everybody uses is gentrification. And I don't think that investment in place is a bad thing. I think the challenge is the loss of cultural identity. Most people are upset about the level of investment because it often doesn't include them, that the plans and the visions for what the type of investments are made for and who it's made for aren't most likely those who have been there, who have lived there, and nor does it truly address the things that they have been asking for decades at times. And so when you lead with that understanding of what has happened before, I think you can have a different type of conversation. I also think that we invest in place from, again, that notion of a deficit scarcity mindset. But when you lead with building upon the values or the cultural assets of a community, it offers a different entry point for engagement, because it actually recognizes that there is great value in that community as it stands and that it's really about enhancing. The cultural identity to me, I think, is an important one, because solidarity, as John Powell says, is I see you. And for many communities, they haven't seen heard, their voices have not been honored for decades. And to the extent that you are entering the conversation with that level of understanding, humility, and willingness to understand those challenges, I think the better. When we go into the engagement process, we often, again, it's transactional. I want an outcome, it's one way, here's what we're planning, tell us what you need. But when you start it at a different entry point that really leads with hearing you and also identifying who has come before, I think it's important as well. Because again, many of these residents have participated in a lot of these discussions and still haven't seen any outcome. So there may be a level of jade. They aren't seeing the necessary rosy colored glasses that you want them to see. And I think it's important for that to be acknowledged up front, and show how you might be engaging or doing things differently and how you're hoping to have a different outcome for the way in which you proceed.
Great, thank you. Jen?
Definitely, I would say that displacement is a huge issue for the LGBTQ community, from like the West Village in New York to Capitol Hill, is being priced out of those neighborhoods. And for the queer community, gay enclaves are not just looking like people who currently live there being priced out, but also an influx of new young people coming into those neighborhoods. So people who are seeking an area where they'd be surrounded by people who are like them, that look like them, that have similar experiences to them. That's something that definitely is concerning. On one hand, definitely we have seen a more inclusive environment here in the United States over the past several decades. So that is in a way a positive, where people can live in different neighborhoods and feel safer than maybe they could decades ago. But these enclaves do also serve as community hubs that often offer centralized resources, like the center in Manhattan that is LGBTQ specific. And as people are pushed out of these denser enclaves, they need to commute longer to access these resources, which are harder for people with less flexible work and home situations. And we know that the climate will impact people more, especially LGBTQ people pushed out of these enclaves disproportionately because of infrequent bus service and infrastructure connecting people, really being impacted by major storms, sea level rise, so on and so forth. And this looks like people not necessarily have access to medication if they're HIV positive. For homeless youth, it can actually be a matter of life and death as well. And we know among homeless youth, around 40% are LGBTQ, so it's a huge portion of people who are very vulnerable already. But that being said, in terms of transportation, right now we're facing dwindling service on transit, pandemic-driven fears, and there's a lot of angles to really unpack there, but something that we are seeing is through the legalization of e-bikes and e-scooters, there's an uptick in the use of these modes, and that the bike movement in New York really is hopefully continue to expand beyond just the perception that the loudest voices in the room have historically and in many ways ongoingly been white cisgender men. So there's no wonder this perception that if you put a bike lane in a neighborhood, regardless, there's gonna be a perception that it is for white cisgender men. But I would say the reality on the ground is different. From bike couriers to food delivery people, there's all kinds of people who are using bicycles for kind of a low-cost, sustainable way of getting around, the low cost being this is really the driver for a lot of people to adopt this mode. In New York, we have Outcycling's Fearless Flyers program, which works with queer youth to combat isolation and promote wellness. And to build upon what Stephanie said in the keynote, I would consider something like Fearless Flyers to even be an example of a community asset that we can build our infrastructure around and more purposefully bring to the table to give an.
All right, thanks, Jen. Our next theme will be, we'll focus on healthcare and transportation. So access to transportation, it impacts lives and personal outcomes in many ways and on many levels, including economic, social, and health well-being. So let's focus on access to healthcare and social services for a few minutes. And this next question is directed towards Flora and Don. How does lack of transportation access impact health outcomes of vulnerable communities? And are there examples of places that are getting it right, or at least are moving in the right direction? Flora, you may go first.
Thank you, Byron. In my brief remarks, I noted how the lack of transportation actually impacts not only health outcomes, but also the accessibility to supportive services that typically we don't really see as being part of the healthcare impact. When you go to the doctors, a lot of what the doctor may prescribe you, is one thing, but then, as we noted, the social determinants of health, which is almost 80%, has a deeper impact in terms of how well you thrive. And so as I think about some areas and opportunities where there are some best practices, in Flint, Michigan, for instance, the CEO there, Ed Benning, who's a very transformational leader, has been able to rally around and create access and capacity for their local health systems as well as the clinics by being able to think and redesign, the fleet services in a different way. And so he's really making an impact on ensuring that prenatal pregnant moms who need access to prenatal care have the timely, on demand, similar to like a TNC type of service for getting to those services. So that's, the agency going to the healthcare providers. On the other side, in parts of Pennsylvania, Rapid Transit, who's another regional provider, and its CEO, Richard Farr, has really been able to respond to the needs of the health systems there. So they were approached by, the large health system in the region to help them address and help reduce the no-shows that they were experiencing for people that could not get to their services and the late appointment. And so I think we also have a great opportunity as healthcare providers, but also as transportation providers, to look at what is going on within our service area. And so there are a lot of tools out there that look at and do an audit of what the impact of transportation is having on healthcare. So leveraging the community health needs assessment the Affordable Care Act has required of hospitals to do every 3 years gives us a great opportunity to look at how we can address challenges of people getting to behavioral health appointments, or accessing drug and alcohol treatment because of the lack of transportation. So really encourage us and the and NJTPA as the regional enabler to bring those those different stakeholders together, because there is an opportunity for us to be at the table, even though we might not think that we need there. So that's just a couple of examples that I can offer.
Yeah, that's really great, Flora. Especially marginalized communities. As you mentioned, pregnant women. These are things that we don't tend to think about when it comes to transportation. And going back to Jen real quick, again, marginalized communities with LGBTQ communities, and their lack of access to transportation. So next we'll hear from Don.
And so what we try to do is we try to use our programs to help bridge the gap, and I'll bridge the gaps or sort of address some of these issues. And like there's always a need for more funding and more, and we provide what we're given to give out. But just for some background, just for the general public, the federal funds, let's say they might be our 5310 funds, which are for senior citizens and disabled individuals. That program, that funding would go to the state, and portions of it are allowed to the MPO. So NJTPA would coordinate that and might do a solicitation for local service providers who would come up with some innovative programs to support some of these things, some of these other programs, and at a local level they can identify local level needs and address some of these issues with these, and so that's what we do. Another thing that we're doing now, using the CARES Act funds that we provided because of COVID-19, is allow for what we call incidental use. We have a partnership with Federal Transit Administration's partnership with the Department of Housing and Urban Development's Office of Public and Indian Housing. And it's basically transit vehicles that aren't being used in transit service can be used for what we're calling an incidental use for other things. So you can bring groceries to people, or have separate services that will bring people to shopping that's outside of routes. And I think we're looking at doing those things, especially if if it's coordination with in urban areas, sort of public housing, and in rural areas it could be some of the Native American reservations, but bringing folks to services that they need during some of those downtimes for those vehicles. It's what we call incidental use, but they can, and these transit operators in regions can use their the CARES Act funds for that. And that's just another way that we're looking at sort of for lack of better, sort of a demonstration to see if it works. And hopefully if they are successful, maybe we can incorporate those into our into future policies. But and you know, another innovative program that comes in the incidental use in Columbus, Ohio, the Transit Authority was working with the YMCA, and they used their buses as hotspots. So children in certain areas that don't have Wi-Fi access could go to those places for Wi-Fi access, so they could do their homework and other things during the pandemic. So so we're trying to utilize what we have to help out in different areas. And Tompkins County reached out to me during the pandemic and said, look, we've come up with a way to utilize our paratransit vehicles to bring either goods or pharmaceuticals to people who are now home, who can't go to the pharmacy because they're sheltering in place. Can we do that? And we said, yes, go ahead. You're serving the people, and this is what we have these services for. So these are some of the flexibilities that we've been dealing with, and I think hopefully the more popular ones, the ones and things that can work can sort of go into our programs in the future.
All right, thanks, Don. And I'm glad you've brought up some solutions in regards to the pandemic that we're currently facing. And that segues us into our next theme, which is the Open Streets program, which is known as, which is particularly one of the solutions that came to mind, and equitable implementation about it. So I'll open it up to everyone on the panel. And since the onset of the pandemic, the concept of open streets has become increasingly relevant and popular. Open streets connect neighborhoods and increase mobility options. We have found that this program is essential to communities that lack adequate parks and open spaces. And it is essential to communities that traditionally have low car ownership, which is usually underserved by, well, not usually, but in some cases, underserved by transit options. However, in practice, we have seen inequitable implementation of open streets with fewer options, poor infrastructure, and poor enforcement in our more diverse communities. So let's talk more about the benefits of open streets and how we can implement them in an equitable and culturally competent manner. Would anyone like to go first?
I can kick us off on the New York City program. So New York City set up an open streets program essentially overnight at the start of the pandemic by putting sawhorses and French barricades on dedicated streets, where we had support of council members and other agencies to target those particular streets. The initial thinking was our parks were not necessarily an area where we were seeing a lot of social distancing. So the first iteration of the open streets was to unlock space next to parks that were street space to basically act as overfill for the parks. We saw that had some level of success, but what made a lot more sense for us after getting a fair amount of criticism on the equity issue was working with communities that were disproportionately impacted by COVID-19 and didn't necessarily have park space. So that was kind of the very early lesson learned on our end. Throughout the summer, we also worked on expanding the program to include locations for cooling. So during major heat events, typically we would open up cooling centers at our city properties. There's also informal cooling centers, thinking of people going to the bodega or a coffee shop or somewhere nearby that has air conditioning if they don't have that at home. And we know that major heat events are especially impactful for our seniors, especially seniors of color who are disproportionately hospitalized due to major heat events and have less access to air conditioning. So unlocking those street spaces by also opening up fire hydrants for cooling was something that we piloted throughout the summer as well, with some level of success. But I would say the key success story of our Open Streets program has been the open restaurants. So we still currently have over 10,000 restaurants operating on our sidewalks, on parklets. There are 359 operating on open streets where there is a sawhorse or French barricade blocking off that street. A part of the success story has also been working with community partners to set up those streets. So we have local buy-in, which is also, as this program has gone on, was part of the lesson learned, I would say. But to bring this back to the queer community, there are queer bars like Cubby Hole and Good Judy that are operating in the city that have an open street or an open restaurant setup. And this is especially important for queer people who really lack that inclusive space for their community. We know that queer people are less likely to be in a nuclear family structure, maybe are more likely to be quarantining alone, and really mitigating high risk activities like going indoors by having an open street option is really important for both physical and mental health. And also just keeping these businesses alive. Like we know there's only 15 lesbian bars operating nationally. We're lucky to have 3 of them here in New York City. And there's a project called the Lesbian Bar Project that's hoping to save these spaces, but really offering up the street as a resource for communities and to keep our spaces alive is something that we're really committed to.
Those are some great initiatives. Flora, would you like to add to that?
Yes, Byron. I would. The comment I want to make is, I know that the pandemic really has given us the opportunity to rethink about how we use our streets. But prior to the COVID, though, there was a great interest and a lot of desire for communities throughout the world to really look at the open streets as a way of enabling individuals to be part of the community. So when I think about my exposure to open streets, I had a chance to be part of a national group of thought leaders that went around the country promoting the concept of open streets. And, in doing so, we looked at the open street in Guadalajara, and what struck me there was the ability of both the private sector and the public sector to partner to ensure that they were opening up the streets for everybody. And they designed it in a way that they looked at the diversity and develop it so that all ages of individuals and all abilities could access the open street. And that meant ensuring that public transit was accessible to, that open street. So looking at, in the future, how do we involve the communities that normally are not brought to the table, right, to help design, which is something, I think that all of the speakers have identified, as well as Stephanie. And it's really, really centering whatever we do, however we decide to design these open streets, looking at the impact on well-being and the accessibility for individuals who might be on a wheelchair. I saw that firsthand when I was also in LA when Mayor Garcetti unveiled its first. I joined in with my brother and we traveled through the open streets that they developed, and I could see how people of all ages were walking, biking, exercising, doing Zumba. And so I think, the imagination is probably the only thing that precludes us from really making it inclusive.
All right, that's great, Flora. Thank you. And thank you, Jen. So next, our final theme is equitable transit access. And we know transit is not meeting the needs of all, particularly in New Jersey. And based on our results from the first round of outreach for NJTPA's Plan 2050, transit usability, especially intrastate and intra-community transit, remains the #1 concern. The Regional Plan Association, RPA, recently released a study called Better Service, Improving Bus Service in New Jersey, which focused on this need and made a series of recommendations for improvement. It appears that riders want optimized customer service and a system that is maintained in a state of good repair. They also want greater public transit usability and accessibility. So what are some ways that we can improve transit service to underserved communities, and how important are corporate and community-based partnerships to increase transit options in transit deserts and rural areas? Flora, would you like to go first and continue with this one?
Yes, Byron, thanks for the opportunity. I want to echo something that the freeholder mentioned at the beginning, and how we have a terrific opportunity of looking at our assets and then centering the needs of our community around our transit stations, our bus shelters, I have not read the report in its entirety, but thinking about what you just mentioned, we should always be looking at how do we ensure that we make it easy and affordable and pain-free for our customers to access our services. And so I've seen it throughout the country. I've seen it throughout, my service, that we need to reimagine building destinations of our assets. So when I think about, our transfer centers, could we locate food? Could we locate daycare centers? Could we address the first and last mile needs of our residents? Could we center all of those needs and bring and be the aggregator? In my mind, transit systems need to be and act more like mobility integrators that ensure that that we're owning the complete trip of our customer's journey. In doing so, there is an opportunity for us to bring the private sector, all the other public sector partners in ensuring that as we reimagine what those destinations need to look like, as we reimagine how our customer service responds to the needs of our customers in a very timely manner, that we're centering that again on the needs of people.
Thanks, Flora. That's great. Would you like to add to that?
Sure. I'll add to it. I look at two things. I think I touched on it. My first one is sort of updating routes is probably one of the first things. Addressing what current needs are, where the current needs are, where the future needs are. That's sort of one of the parts that Flora's getting into, is that, and because and let's look at the whole. New Jersey, as Stephanie pointed out, is a home rule state. Land use system, and so I think it's that dichotomy, because if you're not including this transportation planning in with the land use planning, then you're going to get that mismatch sometimes of where transit systems are going and where people are located.
I want to. Oh, go ahead.
Oh, go ahead, Stephanie. Go ahead.
I want to build upon that a little bit more too, because this intersection between land use and transportation kind of goes back to the initial question around how do you invest in place without displacement? And without that undergird, you miss the opportunity. And I think Njtpa offers a really great opportunity because they can serve as the convener in many ways. When we start to have the conversation on what transit investment looks like versus land use, it's like, well, that's not my territory. But actually, everyone needs to be at the table, including the local governments, to have the discussion intentionally for residents. And I don't know that fully happens in New Jersey in the ways that we really can further that discussion. But there's so much opportunity. One of the things that I loved about Orange is we had 2 train stations. New Jersey was actually one of the first to have, when we talk about TOD now, our transit village designations in the late 90s were some of the first to really kind of talk about that intersection and being able to support kind of these smaller towns, but also the region more specifically, and being able to leverage the transportation investment with the economic and the land use around it. And so when Flora was talking about the notion of transit being that hub, you see that in so many places, and yet the level of investment that is required to maintain the system is one where we have to really be intentional about how do we want to invest and where do we want to invest as a region, recognizing the inherent role that transportation plays in supporting economic development. And it's a hard discussion as well, because the local municipalities do not control New Jersey Transit. It becomes a governor conversation. How do we invest in it to ensure that it's being able to get the resources that it needs? But how are we bringing all of those people to the table is just really critical. even when you think about the diversity of the boards of the various commissions and authorities that New Jersey has oversight over, much of it never includes community. And the only time that someone has access to that conversation is through the public hearing process. But how do we intentionally build some of those pieces in? So kind of going back to that notion of just how we think about investment in place, really recognizing the asset that transit plays more specifically, but then transportation plays as an economic engine. How do we really support that integration across the various sectors so that there is a trifecta that offers that economic, that social, and then even just that environmental place for, bringing back that open space concept where people can, walk to and see it as a destination that they can get to easily, especially during this time of COVID. This pandemic this year has allowed us to see the things that we've turned a blind eye to in so many ways. And so there's going to be a forced reality of how we invest, where we invest, and what we invest in, just as a result of those decisions. And I think that there's great opportunity to really kind of build with a different vision in mind.
Yes, definitely. Oh, Don, you could go ahead.
Yeah, so I was going to say, and following that up, I did a panel a couple of years ago on trans-oriented development, and the city of Rahway is doing quite a bit of development around transit-oriented development, and they saw one of their assets were their parking lots and parking garages that they had more than they needed, and so it enabled them. They RFP'd some of the sites out for not just economic development, but also housing development. And by doing that, they were able to, they were able to provide new housing for new people to come in without displacing people who live there, which I think it just tells you that, if you think about it and you plan for it, you can actually do it. So, just and using that as an example, and again, they have a beautiful station right there, center of town, walking distance to a lot, and so they're utilizing those assets that they have to sort of redevelop and reframe and pivot what's going on in Rahway. So I think you do have some examples again where you are getting. No problem. You do have some examples in New Jersey where you do have that sort of things going on, development going on, and I think that it's just continuing to grow. I think you have developers here that are looking at doing that along the river line in southern Jersey. They're doing that sort of trans-oriented development too. So and I would just continue to encourage it. So I think that's part of the equity as that trans-oriented development goes in. One of our concerns is that trans-oriented development could lead to gentrification if it's not done correctly, and which is not what we want to see. Transit is supposed to be accessible for all, so we want to make sure that it is. So we like to, and I think that's why we're sort of having these partnerships now with HUD and FTA more and more, because we want to make sure that there is accessibility and there is enough housing, and we don't have that same displacement. That's one of our concerns. And just to let you know that, when we do look at a lot of new projects, we do give a hard look at the land use aspects of a new project. But in terms of equity, the other thing that I've seen in Denver and Seattle and Boston, I know they've been looking at fare equity and looking at changing their fares and fare policies to be a little bit more equitable. And there are a number of concepts that you can do in terms of fares, and one of the newer ones I saw is called best priced fares, and the concept sort of eliminates the upfront cost of a weekly, monthly pass that a lot of people can't afford, but it allows you to enjoy the sort of best price calculation. So let's say the fare is $2, and so the max 1 day fare card would be, for your unlimited ride fare card might be $4 or $5. So Best fare would see once you've reached that $4 or $5, all of your trips after that would be free. And so you wouldn't have to purchase an unlimited ride card. Just if you made those trips, then the rest of the day is free as long as you had the card. So I think that's a different way of doing it. It's a different thought process of doing it. There are a lot of ways to do it. So you don't, which just reduces the need to sort of have a full unlimited ride card, which some people can't afford, but would still afford people the opportunity to have the benefits of an unlimited card on a daily basis.
Yeah. Thanks, Don. I really appreciate the initiatives that you, Flora, Stephanie, as well as Jen has communicated to us today. We, so much. Thank you. So now we're going to pivot to Ted, who is going to lead the way with some of the question and answers from our audience. All right. Thank you again.
Thank you, Byron, and thanks to all our panelists for a very insightful discussion. I'm going to try to get to and try to group questions together so as we don't take up too much time, but still get to address some of the ones that came in. So first, Stephanie mentioned historic policies and laws that adversely affect Black Americans. Do any of you have examples of ways to effectively address these adverse policies?
Yeah, the first piece is I think if you take that targeted universalism piece, the first piece is to what is your outcome goal? What is the limitations and barriers as a result of that, of those policies, really understanding how those implications still see itself playing itself out now. I mean, it's so interesting when you think about that infrastructure being built 60 years ago, and essentially every time we fill that pothole, may be reinforcing that same inequity, right? And being able to understand the connections to those pieces are critical as part of those pieces. So identifying those levers that limit or create those barriers are critical as part of this discussion. And it may not be in your sector. That's the other thing. I think that's where we then stop because we're like, well, I can't solve for that issue. But that expansion of the collaborative table, because we experience, again, that's why we talk about systems and that it's interconnected and dynamic. You actually still need to bring in those other parts to ensure that you are benefiting and that you're addressing kind of all. So being able to understand how those laws still play, changing those rules. We have a lot of rules on the books that not only do we not enforce, like when you talk about the challenges of gentrification, a portion of it sometimes is the actual enforcement. We actually have laws on the book that say certain things, but we don't actually enforce those policies. And then we do need to update our policies to actually meet the challenges of this moment. When you think about the Constitution, that's why I use that as the framing up front. We had to literally do the work to amend it along the way. So you could also quickly, if you see the barrier, kind of create the new policies to redress those past policies and tackling what exactly was the challenge as part of those pieces. So I'll pause there because I know we have a lot of other questions.
The Njtpa recently published a paper on active transportation. We had a question about that, and I was thinking that probably Jen's going to want to address this one, but obviously it's open to all the panelists. So if you're a transportation consultant, let's say, how do you sell a bike grid or an active transportation, people-powered mobility grid to elected officials to make it something that will have the value that they recognize and want to invest in?
There's a million different angles to take that on, but I do want to go back to what Stephanie said earlier around community assets. There are people in your communities who are already using active transportation, and there's both formal and informal groups taking advantage of that. And those groups are from a cross section of society, people of color, people low income, queer people. You can find people in your community, especially thinking of a state as diverse and as kind of multifaceted as New Jersey. I am confident that you can find people within your community to be advocates both on the ground and in the organizing that you're trying to do with elected officials. That I would say is probably our biggest barrier to making infrastructure happen here in New York City. And that's something that we have tried in many different avenues to take advantage of.
Excellent.
Can I also push maybe on the narrative that you're trying to sell it, because it's to assume that somebody wants to purchase it. And I guess being able to just kind of ground, is that truly what the community wants? Have you given them an incentive to actually see the possibilities of what that could look like? Because to some extent it's experiencing it, that maybe there could be buy-in, and then tying Jen's response back, you know, if the sell is to the elected, then you go to the residents, right? Because they're their main constituents as part of those pieces. So when you find those two together, you might be able to actually get what you were hoping for as an outcome. But I would, I guess, start with the premise of like, that's a transactional, because it is to assume that somebody wants to buy what you are asking for as part of that.
I was glad to see the topic of open streets come up during the panel presentation. So one of the questions was, with winter here now, how can open streets change to provide accessibility to spaces for food purchases, restaurants, and retail in a safe and healthy way, and still protect against the cold, other elements?
Yeah, that was a huge question for us when we expanded the program throughout the winter. It's already cold outside, so being outdoor dining or being outside right now is not always the most pleasant experience. What we did on our end is work with our fire department to create a framework for what sort of outdoor heating we'd be comfortable installing in our public space, knowing that historically our fire department has been more conservative around risk for fires, which notably we don't want to have fires take place because people are outside, but we have a rubric to use electric heating, gas-powered heating, as well as propane heating. And my office did a kind of back of the napkin analysis, and we'll be monitoring it going forward of what would be the impacts on emissions. And we found it was very minimal to have outdoor heating available to people. And just the benefit of having community spaces is definitely first and foremost, as well as keeping these businesses running as much as we can throughout the pandemic.
Maybe offering insight to some stuff that DC is doing as well. The mayor has also worked with the small businesses and who are, already adversely impacted by the impacts of what COVID is doing, to offer additional resources to pay for much of the heating systems that may be, in addition to the coordination with kind of emergency management. So just kind of, again, to that small business aspect too, you want to hold the holistic pieces, seeing what incentives you can provide for them, through the colder weather times as well. Food trucks have also been opportunities too. It's opened up a new market in that sense too. And so kind of holding space for what had been limited in permitting for food trucks, offering them in kind of more neighborhood spaces to offer another incentive as well.
A lot of the focus in transportation planning is on performance measurement. Are there best practices available to measure equity?
I'll take that. One of the recent projects that I've been exposed to is the great work being done by I think it's the Transportation Center that's based in the University of South Florida, and that's they're developing an equity scorecard as well as an index that is in beta. Right now, and the local NPO is utilized, and that looks at all the measures of low income, access to healthcare, and it should be available towards the end of I think it's May or June 2021. So that index is grounded, in the whole holistic of looking at all the systems as we've been talking about this morning. So I can share that with the public.
The Federal Highways Administration also had a Connecting Communities initiative that really kind of set some performance or offered some tools for what could be performance measure standards. It kind of came from an original initiative that was really looking at how to leverage kind of that highways, as I was talking about 280 examples, but to kind of reconnect communities. And so a portion of it was being able to also do performance measure standards as part of that. So I'd highly recommend that. Virginia created their own scorecard that also centered equity. It was like kind of the first where state was able to kind of infuse the equity considerations as part of it. And then I would say the Twin Cities and Minneapolis areas, Minneapolis specifically, they created they were one of the first to create kind of a equity scorecard about 6 years ago. It needs to be updated now. King County also has examples. So there are folks who are doing it.
All right, great. I want to make sure that we end on time. I promised that we would, and we're just about at that time. So, you know, I just want to take a minute and just thank all of our speakers and panelists and you for a super engaging and enlightening program today. It's been great. And, you know, it's true that Plan 2050 has to be fiscally constrained. We know that, right? But that doesn't mean that we can't do some of the radical imagination that Stephanie talked about in her keynote. And I think the pandemic has provided some opportunities for that. And Stephanie talked so much about opportunity, and that's a lot of what Plan 2050 is about. Maybe there's ways that we can do radical imagination within fiscal constraint. And maybe we can look to the pandemic as some examples of shared use of public spaces and how we can address inequity there. So we have one more TPA Tuesday program coming up, focusing on opportunity. That'll be, I think, late next month. And a whole series of new Plan 2050 public engagement opportunities and virtual events that are being planned for January, really into early March. So I would encourage you to share those ideas with us and continue with us as we develop our long-range plan. Updates always available at njtpa.org/plan2050. Don't forget to take our survey if you haven't already. And thanks again. And I just want you to have an awesome day. Thanks.